So I came up with that system where I used hormones and optimized nutrition and optimized detoxification and optimized the body oxygenation, and then the fifth area, which was the heart, mind, or joyful purpose. And what I started to learn is, and you can do any one of those areas in using different mechanisms. You can use hormones, but you can also use acupuncture, but you can also use energy medicine. You can use herbs. The idea is to use the things that resonate with the person, let them pick the things that resonate, and then help them to turn on innate self-healing. And what I found out is that if you work in those 5 pillars, even if you do one thing, it has a ripple effect on everything else. So the way I learned to integrate was really because I had the benefit of being in a medical center where I started to hire energy medicine people, sound healing, acupuncturists, chiropractors, people who did things that I didn't know anything about, sound bells, DOs, MDs, chiropractic. I mean, just every field. I had 50 different people in there over the 22 years, and I learned. And I started to learn, like, how do you put these things into protocols? Do you have to use these supplements? Can you use energetic methods? Can you use, frequency devices? And I got to do a lot of experimentation and see what works and how many things you can offer people, because I have found that the more options people have, the more empowered they feel, because they can pick what resonates rather than, oh, these are your options, 1 and 2, or you either do this chemotherapy or you do this surgery. It's very disempowering to have that kind of approach. So the integration occurred because of that, and it did end up in me going from doing 3 to 4 surgeries in a week to doing 3 to 4 in a year eventually. Like, obviously you get to figure out with root causes how to reverse endometriosis and fibroids and weird things that shouldn't be in the body. So I don't even know how to do surgery anymore. I think I'm scared of looking at blood that I created. So, yeah.
It's so refreshing to hear you speak, because I think this is the language that my clients and my patients hear every single day.
Mm-hmm.
And there's some people who come to us because they're curious.
Mm-hmm.
They're like, I hear about this, or or the other, I say, a third is just curious and they don't know exactly what expecting, or they think they have an idea. And then it's like the other third is like, I don't believe in any of this at all. I think it's all woo-woo, but someone that I know and trust and love said they came to you and you helped them out. So I'm here, but I don't believe in it. And I'm like, you don't have to. You just need to believe in me. And then there's that other third that's like, I don't ever want to see a Western medicine doctor again in life. And I'm like, wait a minute. There's room at the table for all of us if we work, when we work together. And one of the biggest things is that I feel like this dichotomy of either or, when it should be both and, because we are better together. And I know this because I, just like you, trained in in 2 different, almost polar opposite, diametrically opposed modalities and approaches to care. But when the mind changes to hold space for both, it automatically opens up an expansive place where healing not just can take place, but it's like healing just jumps in there. It's like, yeah, let's do this, because it is exciting. You are giving your body what it needs.
Yes.
There is no pushback. It's holding space for all the things at the timing and at the pace, so that your body can do the things that it was designed to do in the first place. And really being able to emphasize and reinforce your body's natural capacity to do the healing work spontaneously. And I think even when our team gets together and we're like, oh my goodness, you talked about all the different practitioners, we have some of those similar, we are even astonished sometimes. We're like, yeah, that happened quickly. We're like, I was, spacing things out. I'm like, this is probably going to take about, when everything goes, everyone's doing things, this will probably take about 2 months. And it literally starts to happen in 2 weeks.
Yes.
And in 2 months, I'm like, we passed that goal a long time ago. And now we're on to goals that you didn't even know you had, because we got the time now. So what else are we going to work on?
Yes.
And so we're even astonished even though we do this for a living, but when watching it actually play out in someone who's plugged in, engaged, wants to, it's like, see? And I think watching that magic happen is just constantly reinforcing that we're doing the right things for the right people, with the right people, and for the right reasons. And just hearing you talk, it seems like you have that same experience when you have those insights. where where do you still get, I guess, get hung up, or where do you find that your clients and your patients get hung up in terms of feeling that they have to choose, that it can't be a both and?
Well, first of all, let me go back to your word magic.
Sure. Yes.
We stopped believing in magic, right? But magic is real. That's because we
Magic is
we
real.
have
Yes.
drawn all these diagrams around what is possible, and
Yes.
turns out that everything outside that box is possible too.
Yeah.
And I do think that people have dichotomy occur when they're going to doctors that say one thing and then other healers that say other things, even if they're MDs, if they could be diametrically opposed. One person telling you that progesterone will help you with your breast cancer, and the other person telling you that progesterone will cause the breast cancer. And because we have a lot of, different modalities, and I think people get stuck in the middle of that. And also, I find that the biggest pressure comes from family, because the family and the friends are the biggest people to start questioning what someone is doing. Like, why are you going to that witch doctor? And I do think that's changing. I feel that the people are starting to realize that they have to be empowered to take their own choices. And
Right.
I always talk about the fact that you you shouldn't believe in me. You shouldn't believe in this doctor or that healer, or believe in yourself to
Yeah.
distinguish and discern what resonates with you and do
Yes.
those things, even if it's just one thing. Any
Right.
one thing that you do and you believe in and you put your energy in is going
Yeah.
to create a ripple effect in your body and in your environment. So that's how I deal with the dichotomy that comes up.
Yeah.
Because I've seen as many people go through cancer doing radiation, chemo, and surgery and getting well as I have laying in the mud, being naked and getting well. And it really has to do with what resonates with me and what do I
And
believe
where
in.
you're putting your energy. Yeah.
Yeah, yeah.
Yeah, and thank you so much for like even making that more salient, because I do find that most people, by the time they come to us, they don't believe in themselves. They and so they're trying to find that validation externally. And even though I so appreciate your perspective, because it's exactly right, I feel a lot of our clientele are so broken by a system. They no longer trust their judgment. They don't trust physicians. They don't know who to trust, and they're very skeptical about, is this going to be more of the same? And I find that we set this tone a little bit differently from the time they kind of cross our threshold. That people are like, oh, you're a different doctor, or you're a different something, and I'm like, I don't know what to do with that, but I'm going to take it as a compliment, because the experience is different. How we set up the overall environment is different, and yet there's that other aspect that want this integrative approach, that wants this healing aspect of the approach, but they still want to have the take a pill and call me in the morning lead up to it. And I'm like, that's not what you're going to get here. And you can't get that from me, because I can't draw, you can't not draw that from a well, because that's no longer what's in this well anymore. And flipping that switch for me was, I can hold space for both of these, because it's not an either or for me, and it never has been. I feel this has always been in me as a provider and as a practitioner. I just didn't have the words for it, or it wasn't quite. There wasn't a board for it, or but it was how I always wanted to practice. But like you said, there was something missing. For you said it was for, like, the surgeries. And for me, it was the birth control, especially on the backdrop of my patients trying to get pregnant. And the
Right.
first thing they do in fertility treatment is put you on the birth control. And I'm like, doesn't make it makes sense based on the model that you're trying to do in terms of controlling things, but it doesn't make sense in terms of finding out and exploring what your body is capable of. And you'll
Mm-hmm.
never be able to do that when it's being synthetically disrupted by hormones that are not endogenous.
Right.
And when I kept when in my I couldn't I mean, yes, I made it make sense based on the protocols that we were given every single day, but in it didn't resonate with me. My thing is, how am I telling someone to go on birth control who's trying to get pregnant? Like,
Right.
that can't, it won't
Right.
work in my head. It's like, it's not,
Sense.
that's a message that's not going to ever resonate with me. Um, but then when I talk about, okay, so let's see what your body can do. And someone's like, well, I've been on birth control since I was 12. They are now, 38. You have no idea what your body can do.
Right.
And they're scared. They're
Right.
like, well, what if it go back to like how my period was before? Or
Exactly.
what if it's worse? Or I can't live like that. And now it's like we're having to deal with the fear and the emotional component of that,
Mm-hmm.
which is also very real. Because
100%.
I don't want you to go back to that,
Yes.
because that's not good either.
Yes.
But then I tell my story, and it's like, but I've never had period cramps. I don't
Mm-hmm.
know what that's like, but I've also been steaming since my first period.
Mm-hmm.
And so I don't know if it's genetic or if the steaming had something to do with it. I'm going to say steaming had something to do with it,
Mm-hmm.
because I've never had period cramps. I've had a
Mm-hmm.
regular cycle all my life. And I think some of these natural healing modalities,
Mm-hmm.
because I've never had any of those things in my body's always has never betrayed me in terms of how we talk about our bodies just doing their own thing. How do you see that in your experience?
My personal experience,
Both and.
obviously, yeah, I think that this is what women and people are hitting, which is they have a barrage of symptoms, much more so than people around the world. They are having aches and pains and weird periods and mood swings and anxiety and depression and unexplained weight gain, and being given semaglutide, oral contraceptive tablet, Advil, and Prozac. And really, internally, they're really looking for a natural root cause approach that they can't get from Dr. Google because it has too much chaos, too much confusion, and, you know,
It's
a
not
lot.
individualized or patient-centered or any of those
So,
things.
so then they're left with, okay, take these 5 medications, one or the other, and oh, by the way, it's all normal. And it is not normal, because if you look across cultures, the whole idea that you should have painful periods is actually not normal. It's because our adrenal thyroid axis is so depleted from our nervous system that we don't have enough progesterone to support that part of the cycle. And that's starting earlier and earlier and earlier. When I started 22 years ago and started measuring these things, it was low in maybe 5 to 10% of women. But now, even in the teen years, it's low in 80% of people. So there's a big difference that's happened because of our cultural, I don't know what to call it, modern life, which is man's greatest disease, is what I call it. And yeah, so I feel like it really, we're not hitting the mark, and the opportunity to realize that either your health coverage won't cover or your health insurance is too expensive, and then you look around the world and you see that we're spending way more than any of the other countries, and we're ranking 35th or lower in our health indices, and there are countries spending way less than us and having better longevity and better health indices and less chronic disease. And you're like, what are these people doing that we're not doing with this advanced medical system? Well, that's the whole problem, the medical system, because we're not taking any responsibility for the normal life habits. Like in Denmark, they do sauna 3 times a week, and it's been shown to be one of the most powerful methodologies of lowering your mortality. Or we're socially isolated. That's one of the most important parameters of chronic disease. And other thing, I could keep going, sedentary lifestyle, you know,